দেখা যাচ্ছে?
হ্যাঁ, দেখা যাচ্ছে স্যার। হ্যাঁ, একদম ঠিক আছে স্যার।
হুম, হুম,
অ্যাবসলিউটলি ওকে।
হুম। সাউন্ডও ঠিক আছে?
হ্যাঁ, আমরাও সবকিছু ঠিকঠাক শুনতে পাচ্ছি।
হুম, হুম।
ঠিক আছে স্যার। এবার একটু আমরা ওয়েট করি। যখনই 4টে
হ্যাঁ,
বাজবে তখনই আমরা শুরু করব।
ঠিক আছে,
ঠিক
ঠিক
আছে।
আছে।
নিবেদিতা দি শুরু করছি তাহলে।
হ্যাঁ শুরু কর, তার আগে একটা স্যার একটু আপনি হ্যাঁ ক্যামেরাটা ঠিক আছে, আর একটু হ্যাঁ ঠিক আছে, এবার রিমি শুরু কর।
Okay. Good afternoon, everyone. Warm welcome to all of you to the fourth and last session of the webinar series organized by PR Thakur Government College on interpretation of survival strategies of nature and human amidst the pandemic and natural disaster. As usual, request for the participants on Google Meet, please mute your microphone. Participants on YouTube, please leave your comments on questions in the comment box. After 15 and 20 minutes, the lecture will start. We have already enjoyed 3 fantastic sessions. First one was on 11th July by Professor Soumitra Basu. Second session was on 13th July by Dr. Moitri Chakraborty. And third session was on 15th July by Dr. Amitesh Mukhopadhyay. Today we'll hear from eminent virologist Dr. Amitava Nandi. And Dr. Nandi has served as former head of Parasitology Department, Calcutta School of Tropical Medicine. Actually, he needs no introduction at all. All of us know him as widely acclaimed figure. It is our great pleasure and honor to have you, sir, among us. So now, may I request you, sir, to present your lecture, please.
Well, thank you very much. Good afternoon, participants, and I feel honored to be in this webinar on interpretation of survival strategies of nature and human amidst pandemic and natural disaster. Now, within this webinar title, I had made my own presentation's title as like this: combating the emerging challenges from dengue and other non-COVID infectious diseases in view of COVID-19 pandemic. As you know, for the last 5-6 months or somewhere more than 7 months, that the entire health scenario, entire disease scenario throughout the world has been taken over by nothing else than COVID-19, which is caused by a newly emerging virus known as SARS-CoV-2. Just to give you an idea about its taxonomic identity, that it belongs to the coronavirus group of virus and highly similar to SARS-CoV or SARS virus, but little bit different, and that is the reason why it is known as SARS-CoV-2. Now, I would like to record my deep sense of gratitude to Dr. Nivedita Bayan and all the members who organized this webinar to make me able to be with you this evening. Basically, my presentation would be a compilation of observations made during the ongoing COVID pandemic, especially in the state of West Bengal, in the field of governance, in epidemic control, and medical research and studies undertaken by me during last few months in relation to epidemiology, diagnosis, and COVID case management in Calcutta. Needless to mention that the disease of the public health significance during COVID pandemic has a very big list, starting from dengue, malaria, other respiratory viral diseases, chikungunya, typhoid fever, tuberculosis, HIV, exanthematous viral diseases like measles and others, other epidemic-prone viral diseases like swine flu, like common flu, bacterial superinfections, that means superadded bacterial infection once the patient suffers from all these viral diseases, and non-infectious organic or metabolic diseases like diabetes mellitus, cardiac disease, kidney disease, etc. Why I stated all these names is that this has got a tremendous implication on the course of the infection, not only of COVID-19, but also dengue, malaria, and other similar diseases, where the comorbidities play a very vital role in the success of the treatment and the patient survival. Now, out of all these scenario, what we have been observing for the last 6-7 months, now I believe all of you, and that is why you have categorically selected a kind of a title of the webinar, the challenges. Now I believe that all of us, we have been daily facing such challenges, and we are in a continuous process to face new and newer challenges every day in the coming days. And a new pandemic on top of endemic disease means the diseases in the previous slides, which I have shown you here, they are all endemic diseases in our country and also in several other tropical countries and even non-tropical countries throughout the world. On this scenario of endemicity of diseases means, let me clarify, endemic means these diseases, they have established themselves to be a part of our social life. Many people would be suffering from all these, one or two of diseases in their lifetime. And we know what is the scenario of tuberculosis, HIV, typhoid fever. And I strongly believe that many of our participants today might have experienced suffering from either one or more than one of these diseases, or even his or her close family members. Now, out of the challenges, what I feel from my own perspective, I have categorized challenges into different areas, like say medical challenges. Obviously that belongs to the medical professional, how they are facing the disease. And when a pandemic, which is highly lethal, highly efficient in transmission, as a matter of fact, in my lifetime, I am now 73 running. In my lifetime, I haven't seen a disease with such a speed of transmission so far. And I believe none of the survivors, even elder than me, haven't seen any kind of such diseases with that kind of devastating speed of transmission. Now, so medical challenges should be number one, and number two would be the administrative challenge. That means the country's entire administrative scenario, because that is one of the area where any such kind of diseases like epidemics or pandemics, it cannot be controlled by doctors or medical professionals by themselves only. It needs a large scale, countrywide, statewide activities and control program, where we need a very well-knit, well-organized and logical administrative support, and which has to be continuous. Third is the economic challenge. All of us, we know how COVID has put the entire world into an economic crisis. I'm sure that all of us, we are aware about our own country, how economically we are suffering, and what is the proportion of suffering, or what is the proportion of the population who are really suffering from economic crisis because of lost jobs and various other issues, including productivity and its distribution, etc. The other issue is social challenge. Again, I am sure that all of you, we are definitely in a position to agree with everyone that the society which was there in the month of January 2020 has definitely changed a lot, and therefore that brought us to this kind of webinar. Otherwise we could have assembled in a hall for a live seminar. Now this indicates that the society has changed themselves as far as the lifestyle, the social style is concerned. But what I am concerned about is particularly looking into the disease, the way the disease is spreading, the way the disease is being handled, the way the society is handling not only the disease but also individuals who are suffering. This is very, very pathetic. This is totally unacceptable. And here comes the role of the politicians and government to raise the society above everything, to join hands with everyone to fight these diseases. And lastly, one of the biggest challenge which we are facing, I feel that it's a political challenge. The society is facing a political challenge from the politicians' point of view. We are facing every day. I'll explain, I'll narrate some of the examples how the political challenge is ruining the scope and future of the COVID, not only COVID-19's control, but also other disease control, or as a matter of fact, as a whole, the entire health system's prospect of giving us a really healthy life in a healthy society. You will excuse me, I have a call from emergency hospital. You'll excuse me for some time. Mr. Gomes, আমি একটা সেমিনারে আছি, আমি এখন লেকচার দিচ্ছি। হ্যাঁ, 6:30 পরে। Let me switch off the mobile. Okay. Okay. Now what I'll do, I'll give you some of the details about how I see into the problems, into different kinds of challenges that are that the community, the medical community, the society, the politician, the government, everyone would be facing. Number one challenge is that all of us know that we do not have a drug, neither for dengue, nor for COVID-19 so far, which can specifically kill the viruses responsible for these two diseases. As a matter of fact, dengue has been known for more than 70-80 years, and yet we do not have a specific drug for fighting, for treating dengue. Similarly, rather I would say that it would be unwise to consider that we would be coming up with a handful of medicines, handful of drugs which will be very specifically eliminating the COVID virus, not only in an individual patient, but also in the earth. I don't think that the discovery of a very specific COVID, anti-COVID drug and its application in the community and medical science would be feasible within next couple of, or maybe if may not be decades, for several years. Similarly, there has been a lot of hype in the media, a lot of hype all around the globe about the development of new vaccine against the COVID-19 virus, that is SARS-CoV-2 virus. And even yesterday in the media, there have been several discussions in different media regarding the prospect and possibility of vaccine being brought in the market for human use, general use. But I would like to keep my finger crossed at least for few years, if not more. I would be too happy if a vaccine comes for human use and available freely in the market within next 1 year. I would be too happy. Now the third challenge, or rather a kind of a handicap which we are having, is inadequate knowledge of various aspects of individual organisms in terms of their biology, in terms of their transmission, in terms of their pathogenesis. I would again, during my course of presentation, I would give you some very alarming and some issues of great concern about these aspects of the knowledge of the organisms. Particularly, I may give a very scathing attack on some of the claims that has come up in the media, in YouTube and other social media, as far as transmission of the virus is concerned, and also the biological aspect of the virus, as well as the interactive behavior inside the host tissue. Hello? Hello? Yes? Yes?
স্যার আপনার কথাই ইকো হচ্ছে, আপনি কন্টিনিউ করুন।
আমার কথা ইকো, আচ্ছা। Now, in this inadequacy of knowledge, I personally feel that we know very little about, when we talk about the interaction or simultaneous existence of all these diseases which I had already shown as a list, like say malaria, like dengue, and we have seen ample examples in our day-to-day medical practice that the same person would be suffering from COVID, he is co-infected with dengue, a dengue patient would be having, in addition to dengue, malaria, so blah, blah, blah. That means, that brings us to the scenario. You just imagine in your community, you have all these kinds of communicable diseases or infectious diseases going on, and every one of us, we are exposed to all such kind of pathogens or the microorganisms, and we do have chances every time, we do have chances to acquire more than one disease at the same time. And at that scenario, we do not have adequate knowledge if a person is having dengue and COVID together at the same time, how the dengue virus, how the COVID virus would be interacting or influencing each other or the host. So this is a very, very, very intricate pathological interactive process which we do not have any idea. This is one of the great challenge, that which disease is moving towards what kind of direction, or the other disease, how it is modifying the course of another disease, we do not have any idea. We just simply, we can speculate, we can presume, and we apply our knowledge individually towards symptomatic treatment of such patients. Now, other challenge would be to undertake medical research on direct clinical, epidemiological aspect, therapeutic, that means drugs, immunological aspect, including vaccine development and disease control, means about which I will be talking in next few slides about the disease control, and that is the essence of today's presentation, how we are going to control the disease, how we are going to help under this scenario of multiple diseases occurring and threatening us, the entire human community being threatened by simultaneous existence of multiple diseases, and on top of that we have a new entity, new guest, rather unwelcome guest like COVID-19 as a disease. Now, the second issue is the administration and economics. What are the challenges that we can foresee the administration would be facing? Number one is the discipline in the governance. I am extremely sorry to say that we haven't seen anything in this line which can satisfy ourselves that the entire governance regarding the disease control process has been well disciplined. The public life, the people, the behavior, the lifestyle of the community, the people, are they really behaving in a way which is scientific, which is uniform, which fulfills all the criteria to be all the criteria of an ideal citizen who can help or who can make himself as a participant in the entire global disease control program? I'm again sorry to say that so far we are yet to see any individual, either alone or as a whole, as a community, giving any idea about their real will and wish to be a real partner in the global disease control program. Then the next administrative challenge comes, how they are managing, how they will be managing the government fund which are allocated towards the disease control. Now we know in our country that the most important two pillars of a nation, that is education and health, which I feel these are only the two pillars which should be considered as the most vital and living pillars of our life, of our community, to build up a real good nation and a society. Now, and all of us, we know how much allocation in terms of fund is made towards education and health in our country. That is one question. The other issue is, even within that amount of fund, within that meager amount of fund which is being allocated in these two aspects of the nation, how they are managed. We are, at least I personally, I am yet to see any sign of real logical and rational management of fund, whatever fund is available towards management of the diseases and control of such diseases. Economic challenges, economic crisis rather I should say, we have so far seen that it has affected our production, our countries and national production, distribution of products, distribution of various kinds of items, various kinds of things, including foodstuff. Its pricing, we have seen, we are experiencing every day that there is no control over the pricing of various commodities, even day-to-day life-saving commodities. We do not see any kind of regulations on the pricing of such commodities. And finally, under this heading, I am again sorry to say that as a whole, in the state, not only in the state, but also in the entire country, we are yet to see any use of such words like quality control and quality assurance. Now, in our life, day-to-day life, I believe that everyone should rather take these two words, quality control and quality assurance, as a part of our life, as a path of our life, so that we ourselves can develop into a highly qualified human being, highly controlled human being, and we can give the society the assurance that yes, I am a quality controlled individual. And similar things we should expect from a government, that the government should also rely and follow the meaning of quality control and quality assurance. And I am sure all of us, we are much aware about the fact that the government has so far failed to show any sign of their quality control and quality assurance. You simply just cannot rely on the government's activity in any form, in any stage of our day-to-day life. Now, the other challenges are to be looked in is the social challenges. The society, particularly, I do not know about other states. I have very little information and experience about other states. But as far as West Bengal is concerned, every time we go to the society and you think of the society, you would see that the entire society has been tuned by the politician to their tuning. So it's a political tuning of the society is a great challenge, is a big challenge towards a successful implementation of the disease control program. Unprecedented low standard of education. I don't think anybody will disagree with me. Social indiscipline and disobedience, which is highly sponsored by the politicians. Social taboo, stigmatization, altered demographic and intellectual composition of the society. It has been done deliberately. There has been a great deal of alteration in terms of intellectual composition of the society, just to fit into the requirement of the politicians. So they have deliberately changed the intellectual composition, demographic composition of our society to fit into their own requirement, to be in the power. Unprecedented and unimaginable degree of corruption throughout the community, including the government. Total lack of social cohesive force except in relation to political interest and corruption. There is no cohesive force. No one is going to come stay by your side when you are suffering. When you face some problem, you will be alone. You are left alone. No one will stand by you. So that is the character of the society. Now it has become like that. Complete disintegration of this society to individualized existence of man with very ugly selfishness. I'll cite certain examples, what I experienced during the COVID treatment, and that is very, very alarming. What kind of society we are living in. You will see how individualized, how selfish, even a father, even a son has become. Then the political challenges, lastly the political challenges. This is a lot of uneducated and mal-educated individuals, nothing else than that. Complete politicization of everything, including pandemic control. The entire society has been politicized. Your life, our life, my life, everything has been politicized. Replacement of a government by a political party. Ideally, there should have been two or different existence of a government and a political party. The political party, any one political party can rule the state, rule the country as a government, but the meaning of government is totally different than a political party. So that has to be realized by the political parties, that while forming a government, they don't belong to any political party whenever and as long as they are in the chair within the government. And that is completely lacking in our state. Severe and gross disregard to human rights and Constitution of India. Every day, every moment, we are observing violation of human rights and constitutional rules and norms in the state. Financial and political exploitation of situations including that like COVID pandemic and dengue endemic. I will show you examples how and why do I at all say, why do I say that there is political and financial exploitation of such diseases, and these diseases have now become highly politically and commercially viable disease. And I have every doubt whether these people will ever try to get rid of these two diseases which are highly commercially lucrative and viable. Now that the challenges have been identified, I would like to discuss two comparable and devastating diseases of current time, and also would like to point out that areas of action and the type of approach for successful control of these diseases, while at the same time I would point out how badly managed they are and their lacunae, not only in knowledge but also in the activities towards the disease control. Now, these are the areas. Basically, what I am going to do is to take up two diseases like dengue and COVID as an example, and to show you how badly we are placed in the disease control program or control program of any such kind of diseases, which whenever it becomes a problem to the society. And I'll give you some idea about the virological aspect, the epidemiological aspect, clinical presentation of these diseases, laboratory diagnosis, management, and epidemic control. And within each category, I will try to show you, I'll try to point out where is the role of a medical professional, where is the role of a common man, so that there is a balancing act is being built up, so that we can jointly try to attempt to control these diseases, without which any such diseases just simply cannot be controlled. Now, to start with dengue, as we know, dengue is an acute viral febrile viral disease which is transmitted during the daytime. Mind you, these few points are very important to understand, where I am really, what kind of hint I am trying to give you. It is a disease which is transmitted during the daytime through the bite of infected female Aedes mosquito, and which presents, the disease presents with headache, bone or joint pain, rash, and of course a laboratory finding of low WBC count in the blood or leukopenia. As per WHO, it is the commonest arboviral disease affecting the mankind. Arboviral means arthropod-borne viral disease, that is the disease which is transmitted by arthropods to which mosquitoes belong. Primarily, as far as even myself, I have seen in my student career, dengue to be an urban disease. But gradually with time, with increasing, this was my part of research activity, that I could incriminate the spread of the disease from urban to the rural setting, along with the spread of the use of plastic disposables where gradually the disease it just didn't encompass itself within the boundary of urban setting, but along with the travel, along with the spread of the use of plastic disposable, it has now gone to rural areas, and now the disease like dengue has become almost a cosmopolitan as far as existence is concerned. Why so? I would give you some idea later on. Now, the dengue virus, as I promised you to give you some idea on different headings. So this is the virological aspect. The dengue virus is a single standard RNA flavivirus surrounded by a icosahedral nucleocapsid and covered by a lipid envelope, mind you, lipid envelope, and is only 50 nanometer in diameter. Now, this lipid envelope is almost similar to that is what is found which surrounds the COVID virus also, and that is the reason why in case of COVID infection prevention, we say always you try to wash your hand with soap and water. Not only your hand, whatever material you are trying to get rid of the COVID virus, you have to wash it. Of course, if at all they are washable with water and soap, Okay. Now there are four serotypes of the dengue viruses, like dengue 1, 2, 3, 4, and I'm not going into the details of the implications of these different serotypes of the viruses, but just to give you some idea that these are the different kinds of serotypes. They not only vary in their genetic composition, but also their functional aspect, including the severity of the disease which is produced by each of these type of viruses. Of course, as far as immunity is concerned, again a terminology, immunity, quote unquote immunity, has long been very wrongly misused. Even nowadays, in the media, you will see they are promoting, many people will be promoting something as an immunity boosting agent. This is a kind of a wrong use of scientific knowledge. Immunity is something else, something which just simply cannot be boosted. That kind of immunity, which is natural, which is innate, that means you are born with that kind of immunity, is known as innate immunity. I'll come to that point later on, but that cannot be boosted. Excuse me. However, as far as the protective immunity against dengue is concerned, each dengue virus or dengue serotype will impart a kind of a immunity which is lifelong towards only to that particular serotype, that particular strain of the virus with which that individual got the first, that infection, following which the immunity persists lifelong. But if he is infected with another strain of the virus, he is not at all protected. Each serotype provides very specific lifelong immunity and short-term cross immunity. Cross immunity means dengue serotype 1 can give a short-term immunity against serotype 2, but it's not very long, not beyond 3 to 6 months. Right. This is the culprit which transmits the dengue virus. That is the Aedes aegypti mosquito. And now you see where the mosquitoes, the Aedes mosquito, they breed. I believe that many of you, or almost all of you, you know that mosquito has got a life cycle which lays their egg in water, different kind of water, a stagnant. It has to be stagnant, but also there are mosquitoes, in particularly in the forest, where the mosquitoes can lay their eggs in the slowly flowing streams also. But mostly they would try to lay their eggs in the accumulated small collection of water where the egg after some time hatches into larva, which changes into pupa, and the pupal stage finally adult mosquitoes, which till that time the entire life cycle goes on within the stagnant water, and once they sorry once they attain the adulthood, they fly from the water to find out their find out their livelihood within the human community, within the animal community, particularly the females, who definitely or must have blood to be sucked either from human being or, as a matter of fact, any kind of animal, to give their eggs a fertilization status, and unless they take animal blood, the eggs subsequently they are going to lay will not be giving rise to larva or pupa or that stage. That means the eggs cannot be fertilized. They cannot give rise to larvae unless the mother mosquito takes a blood from human being or animals. And that is the reason why they always keep on searching where from they will suck the blood. And therefore, that is one reason why they always prefer to be either in your own household or be remain as a peri-domestic partner in your community. These are the two pictures. The left hand side on your screen shows the scenario of the footpath in Calcutta city, and the other one is just a suburban area, fringe area of the city, where you can see how the plastic disposables are getting dumped, somewhat like this. And all these people who are pavement dwellers, as you see here, they are also in part responsible for being a partner for mosquito development and disease reservoir, acting as a disease reservoir in the community. All these are potential breeding places for dengue mosquitoes, not only dengue, but also, as we are talking about dengue only, but these are all also the habitat or the breeding places for the malaria mosquito also. Now, this is the life cycle of the dengue in human being, as you can see here on the left hand side of your screen. Number one, first stage, the mosquito bites a man, where it transmits through the saliva the virus into the human being, and the virus replicates in target organs which are colored blue, and they are lymph nodes. The draining lymph nodes play a very vital role in the viral replication at the initial stage. Then the virus infects WBCs or white blood cells and lymphatic tissue in other parts of the body and nearby. And that through the bloodstream, they get circulated throughout the body, and while circulating through the peripheral blood vessels at the next time when the mosquito bites, number 4, the virus released in the circulation of the blood circulation, and second time when a mosquito bites, it takes a blood meal from that infected individual, so that the second mosquito gets infected with the virus, and the virus then next time starts its replication in the mosquito midgut, and after replication they come to anteriorly to lie in the salivary gland, and they are now ready to transfer the infection from one patient to another healthy man. So this is how the life cycle through the mosquito, the dengue virus is related. Now here, out of all this life cycle, what is the use of the knowledge of this life cycle? That means, as I told you, I hinted at some point that the Aedes mosquito is a day biter. That means from the morning, from sunrise to sunset, This is the time period when the dengue mosquito bites. Now, as a matter of fact, whenever we talk about some control measure, whenever we talk about some lifestyle modification to control all these diseases, these are the issues, these are the points which are to be kept in your mind. Now, using a mosquito net at night is totally wrong process, wrong method, wrong habit to prevent dengue, for the dengue control. Because the mosquito bite during the daytime, and in the daytime we do not use a mosquito net. So we have every possibility, every chance to be bitten by an infected mosquito, and that is the reason why I always say getting an infection of dengue for a person is always a possibility. It just cannot be avoided, cannot be prevented. But in a patient of dengue, in a patient of fever who is suffering from dengue, it is your responsibility to prevent the transmission at this stage, number 5 on your left hand side of the screen. The second mosquito ingests the virus with blood. Now, at that stage, you can have your social responsibility and role so that you prevent the subsequent transfer of the virus from the patient to the community by putting a patient under mosquito net throughout the daytime to prevent the virus to others. Now, this is the global distribution of these mosquitoes, and so also the dengue. These are few slides, these are some clinical slides, but I am not
Sir?
going into details.
Sir, just interrupting you, can you put the slide into full mode? That is called, it is people can't see the slides clearly, so just make it full screen.
No, this is full screen.
Okay, it's full screen. Okay.
Yes, this is full screen.
Okay. So
It cannot be enlarged further.
Okay, it's okay. Okay, sir. So please you continue.
I'm sorry for the smaller font size, maybe.
Yeah. That might be the reason.
Yes. Had it
Anyway,
been green, then it would have been much easier to visualize. But I believe that everyone will be having a laptop in front of them, and for the timing they can go close to the laptop screen to read out.
Yeah.
We don't need you to be seen in the screen, so that you sit down making a quite, effective distance between the camera and yourself. This is the time to read, so you can go close, no problem.
Okay. Okay, sir.
I'm extremely
Just
sorry.
continue. It's okay, fine, sir. Now continue, please.
Okay. Now, after the disease takes place in an individual, for a common man, he must know what are the complications. Why we are bothered about the dengue as such a kind of a threatened, dreaded disease. Number there is a fall in the platelet count, about which many of us, the entire society is very worried, and they keep on counting, like say people involved in the share market. They every time, day and night, they will be following the fall and rise of the shares in the market. Please don't do that. Platelet count, platelet has got very rather low importance to us, the treating physician. We know how to manage platelets, there is no problem, but there are many more other bigger complications in as far as dengue is concerned than platelet count. Now, they are hepatitis leading to hepatic failure. This is a very, very serious condition, and in many of the cases this is being done by using wrong drug at wrong doses, particularly use of paracetamol. That means I am not allowed to take the brand names, but paracetamol is one of the very important drugs which is responsible to lead to the hepatic failure. Excuse me. Uh, this is a drug which is highly responsible to cause hepatitis, drug-induced hepatitis, and the hepatic failure. Then polycirrhosis, accumulation of fluid and protein in the pleural cavity, in abdominal cavity, which leads to serious consequences. Then circulating system, this is where also the role of common man and the family members are highly important, particularly making patient overloaded with fluid. Please don't overload a patient of dengue by asking him to take liters and gallons of water. Please don't do that. Just leave it to the requirement of his daily fluid requirement. As far as possible, you just leave it to the individual patient. Just to meet his thirst, whatever amount of fluid is needed, allow that. Don't force to take more and more fluid. I will show you the consequence later on through pictures. Now, there are neurological consequences which involve the brain and other parts of the nervous system. But fortunately, in dengue, in majority of the cases, the neurological consequences, particularly even if it is some kind of a paralytic stage, paralysis of one individual arm or a side of the body, that is reversible. It just reverts back to normal after a few weeks. But most important and most dreaded consequence of dengue is a sepsis. Now, all these complications, I told you, I promised you that I can give a comparison between dengue and COVID. In case of COVID also, these are the complications which you can see in COVID also. So the final and the most dreaded complication is sepsis and septicemia. Now these are few pictures for the common people, how to identify. This is a kind of a thing which you can observe in a case of fever. If he is suffering from dengue, his tongue becomes coated like this. I give this whiteness to a kind of an ivory white. I believe you will agree with me. This is a kind of whiteness that which can be compared to ivory white. Now the tongue becomes very thick, or sometimes the tongue becomes like this, granular. As you can see, the taste buds are emerging out of the tongue because of some pathological process inside the tongue tissue. Now this is a picture of nose bleeding. As you can see here, black blood clots are accumulating in the nose, and you can see the red blood oozing area also. Now this is a picture on your left hand side of the person who had a lot of water and who was forced by his family member, because he was suffering from dengue, to take more and more of water, making his face like this swollen. There was accumulation of fluid throughout the body, and finally he had to be hospitalized for draining out the water through different medications and different processes. And now you can, after treatment, as you can see, you can compare what was or what should have been his normal face. So this, please do not go for overhydrating a person. That makes the situation much complicated. Now I'll quickly skip through some of these slides just to show you the rashes in dengue. 1, 2, and this is one kind of rashes where you can elicit something what is known as blanching. Your fingers, you just give a gentle pressure and you take off your hand, and immediately you observe that you leave behind a blanched area corresponding to your fingers pressure. And if this sign is present in a case of fever, almost you can be sure that he is suffering from dengue, or at least that can guide you what kind of test or what kind of further proceedings you are going to take or follow with the case of fever. Another type of rash, as you can see, peculiar color, and it has involved the entire forearm or arm. These are the bleeding which we see in case of dengue, hemorrhage. This is a hemorrhage which has occurred, which has involved the entire back and front and the buttock, everywhere. There was a huge bleeding areas. Accumulation of fluid inside the abdomen to make the abdomen bulging, swollen. And this is a picture to show you what happens in case some of the extremely extreme consequences of dengue. This is a picture of the urine by a patient of dengue, which is known as black water fever. This happens in case of falciparum malaria also, or malignant malaria also, where there is breakdown of RBCs inside the blood vessel and the blood becomes completely broken and the hemoglobin comes out of the RBCs and it is excreted in the urine and giving a kind of a color which is compared to cola, any kind of cola. So this kind of cola color urine, either you can suspect the patient is suffering from dengue or malaria. This can happen with many other diseases where this kind of intravascular hemolysis is occurring. And I believe that in some of the cases of COVID, we are yet to see, but I believe that definitely we are going to see similar kind of consequences in COVID-19 also. Now, diagnosis of dengue is, clinically, how you can suspect. There may be fever, there may be headache, there may be retroorbital pain, that means a pain behind the eyeball. Myalgia means muscle pain. This is a singular characteristic feature of dengue is myalgia or pain in the muscle throughout the body. Sometimes it is accompanied with arthralgia, means joint pain, or rash depending upon the day of the fever, then hemorrhagic manifestation as I showed you, and leukopenia. Now this is a slide, rather I would stick to this slide, graphically presenting, and this is a very important slide, just not only for you, but also the medical professions who are observing or who are participating in this webinar, that this is a graphic presentation of the course of the dengue fever, and you will be surprised, this is almost same in COVID-19 also. I'll show you later on. This is almost same. Now, as you can see here on the left hand side of the screen, there are, in the center there are three colored lines. These are the two lines. This line depicts or represents the viral load in the blood. The green line, that depicts the fever, range of fever, or amount of fever, and the duration of fever and the dynamics of fever, how it is rising or coming down. And this line, the yellow line, represents the development of the antibodies belonging to the class of IgM, and where, as you can see here, the IgM rises to a particular level only when it is preceded by fall in the viral load as well as the intensity of fever. That means, in a nutshell, it is appearance of IgM starts only after, or appreciable appearance of the IgM starts after decline of the viral load, and so also the intensity of the fever. That means once the patient becomes free of fever, you can send the patient for testing for IgM. As far as diagnostic test is concerned, please do not send a patient for IgM estimation as long as fever is there. It is going to be negative all the time, because of the simple reason that the IgM to appear to a significant level, it takes time, and once the IgM gradually appears, it eliminates the virus so that the viral load declines and the patient becomes afebrile. So what are you going to do at the initial phase of during the first 4 or 5 or 6 days? Now I'll show you what are you going to do. Now this is another slide to show you during the first attack. In this left hand side, This is the period of viremia, means presence of the virus in the blood. Virus can be isolated from the blood, can be diagnosed by taking blood in different ways, and so also because the living viruses are there, sometimes the part of the viral body can be detected through the examination what is known as NS1 antigen test. So use of NS1 antigen test is always only during the febrile phase, and once the patient gets rid of the fever, you should never go for the testing of NS1 antigen test. Then you go for IgM test. Now this is in nutshell, in totality, to show you, it's a very important diagram to show you what we can do and what are the, how the disease gets complicated at what time. Here are the days of illness, as you can see, from 1 day to 10 days. Temperature usually comes down within 4, 5 or 6 days with a kind of a, this is what is known as a saddleback type of a picture. That means it comes down and then goes up again with a small return of fever after 1 or 2 days. And finally, it clears itself within 6 or 7 days. Now, as far as the clinical issues are concerned, initial phase, the patient feels very dry, he is dehydrated, and then during this phase, when the fever comes down, when the antibodies, they start rising, when there is formation of immune complexes in the blood, at that time, there is every possibility, the complications like shock, like bleeding, it takes place during this time at the later part of the febrile phase and in the beginning phase of the recovery phase. This part is known as recovery phase, and this part is known as the febrile phase or viremic phase. As you can see here, this dotted line is represents the one blood parameter, what is known as PCV or hematocrit. It rises because of the dehydration, while the platelet count, it falls below normal level, and we, after entering the recovery phase, the platelet count automatically increases. And during this time, in this phase, as you can see here, as long as viremia is there, IgM is not available in the blood, and with the appearance, with the arrival of the IgM in the blood, the viruses are killed and it goes off, and so also fever. So this is in nutshell the entire natural history of the disease of dengue virus. And at the last part, I'll show you what should be our approach, what should be our lifestyle as far as dengue control is concerned, not only in individual households, but also community and the government program as a whole. Next, I move to the COVID-19. Is a disease, and I also, it belongs to a group of virus which is known as coronavirus, and out of the virus, this is a classification, taxonomical location of the virus, just to show you, this belongs to the beta group of coronaviruses, and into which group all the three viruses like SARS-CoV-2 or SARS virus, then MERS virus, and the newly emerging SARS-CoV-2 or the COVID virus belongs. This was earlier we knew about any kind of coronavirus. The life cycle of the virus is like this. The bat is the natural reservoir of many of the coronaviruses. Of course, we do not know yet how the present coronavirus or COVID-19 or SARS-CoV-2 originated, where it originated, and how it mutated and entered the human society, human community. We do not know. But this is a kind of a proposal, this is a kind of a knowledge we know which is applicable to other coronaviruses also. So therefore, we can also think that there might have been a similar kind of life cycle wherein the COVID-19 has spent or has come from bat to pangolins, and from the pangolin meat, that person in the who would be working in the meat shop there in the Wuhan province of the China got infected, and then the disease mutated. During this time, the virus mutated to adapt itself to human transmission, and now the virus has become a new virus which can transmit itself from human to human. Now these are some description of the virus and the disease. I am not going into the details about this, but just for your knowledge sake, that this is a kind of a beta coronavirus which has got 5 important proteins on the surface of the. This is the picture of the virus. As you can see here, this is the nucleus of the virus or the core of the virus, where the RNA or the genetic code is preserved like this, and which is surrounded by an envelope, and from the envelope emerges different kinds of spikes or kata. There are different kinds of katas or coronas, and that is the reason why this gives a kind of a shape which is known as crown shape, and that is the reason why the virus is given the name of coronaviruses. And out of all these different kind of spikes, it is the spike protein or the spike glycoprotein or S protein which is important in the sense, through that spike protein the virus gets attached to the cell surface of human respiratory tract, but present in the from the nose, nasopharynx, the mouth, and oropharynx, bronchus, and the entire respiratory tract. And these are the epithelial cells who have the receptor, matching receptor, like, what should I say? It's kind of like a lock and key. And maybe the virus is having the key and our cell is serving the purpose of a lock. So any kind of organism which will have a right type of a key for our receptor ACE2, it can open that lock and can enter the room, that means in the cell. And unfortunately, the COVID-19 virus has got an appropriate receptor for that, or appropriate key towards that receptor. And through this receptor binding, as I was telling you, that through that spike protein, there are important events takes place. That from the spike protein it gets attachment to the ACE2, and which is helped by a protease, enzyme protein, which is known as TMPRSS2, to form a kind of a cleavage into that binding, and through that cleavage it enters the cell, the epithelial cell of our respiratory tract, where they go on multiplying and finally at the end of the multiplication process they inject their genome into the cytoplasm of the human cell, where it goes through different kinds of processes to manufacture different parts of the viral body, and which gets assembled here through a process of viral assembly to make individual complete viral particle available here inside a vesicle, and the vesicle travels and gets ejected out of the cell to infect another new cell. And this is how the life cycle of the virus inside the human host goes on and on and on. And at this stage, now, so with this type of viral replication, let us now see what is some of the important features of the disease, particularly through what entry point that virus enters. The portal of entry is always through nose, mouth, and eyes, because the respiratory tract is the primary target organ for the COVID-19 virus. Although the viral receptor, the matching receptor, as I have shown you perhaps here, they are present in the not only in the respiratory tract but also in the lungs, the GI tract, kidney, blood vessels, and the heart. Now, from in these organs, as you can see here, the virus, the disease gets transmitted only through, and again I should repeat, only through droplet infection or droplets from a person who is already infected. Now, the droplets, they can be of different kinds of sizes and having different weights. The larger the droplet, these are the larger group of droplet, as you can see here. They fall quickly, very closely to that particular individual who is sneezing, who is coughing, and because of the gravitational force, they cannot float for much time, much longer in the air, and they get settled very close to that individual. But in comparison to these droplets, they will be very, very fine and very light and very small, tiny droplets which can stay in the air floated for a much longer time. And if at that time a slow breeze blows or artificially they are put in front of a blowing air, they can be blown to any distance, any place, depending upon the velocity of the air and the distance it travels. And therefore, you are not really very sure that how much distance one should maintain from a person who is infected, whether it is 2 feet, whether it is 2 meters. It is still, we are not sure what would be a safe distance to maintain from a person's, between two persons of infected and a normal healthy individual. And that is the reason why we always say that everyone should wear a mask, so that even a very light floating droplet cannot enter the mouth, nose, and eyes of an individual coming out from an infected individual. Of course, we can avoid the larger droplets by maintaining a distance at least 2 to 3 meters from an infected individual. But the question comes, how do I know who is infected and who is not infected? That is $1 million question. That is a big issue, and that is ruining the entire control program of COVID-19. Now, so after the virus emerges out to infect more and more cells, gradually the area of infection, as I told you, that it enters through mouth, nose, and eyes or conjunctiva to infect the upper respiratory tract, but that again goes to a lower respiratory tract with time, and with time the viruses can move on to infect other organs like, say, intestine. And in COVID-19 infected individuals, we do see some of those persons having, or predominant feature, that COVID infected individual, apart from fever and other symptoms, they do have diarrhea. And once the patient has diarrhea, that means, that indicates that his intestinal tract got infected. Now, as I told you, the portal of entry is through nose, mouth, and eyes, through direct droplet infection by coughing and sneezing. But indirectly, the virus can infect any person through the fomites. By fomites, I mean any object the infected individual is using. For example, an infected individual is using a mobile, and if you share his mobile, definitely there is a possibility that through the contaminated mobile of that infected individual, you yourself get the infection. So the ideal situation is never, under this pandemic situation, under this kind of situation where the virus is airborne or droplet borne. Never, never and never share any personal object of an infected individual or a diseased individual. Never do that. Apart from that, there is a possibility, particularly in children, the virus moves out of the body through stool, and particularly the mother of the infected child, very young child, who gets cleaned up by the mother after defecation, the mother get the her hands contaminated with the virus. And be careful therefore, and always wash your hand after cleaning the following the defecation of the child. Always try to clean your hand thoroughly with soap and water, may be followed by any kind of alcohol based sanitizer. So far there has been no evidence of sexual transmission excepting kissing, and the virus cannot penetrate the skin, so there is no skin to skin transfer of the virus. But if the skin of the patient, for example the hand, he coughs and covers his mouth with his hand gets contaminated. Now if your hand gets contaminated, so skin to skin transfer from one person to other goes through the handshaking or something like that. When the second person puts his hand to his mouth and nose to get the infection to his own nose and mouth. So never do that. But the virus cannot penetrate the skin, living skin. Similarly, there is no insect vector, unlike dengue, which can transfer the virus from one individual to other. So far, we do not have any non-human animal reservoir in this pandemic. It is the human being who is the sufferer. It is the human being who is the transmitter and who is the recipient of the virus. So it is always within the humankind, from man to man transmission. And just to remind you, transmission is not so far been detected or shown to be dependent on seasonal factors, and we do not have any knowledge about the influence of any ambient temperature. We have seen politician claiming in West Bengal, the politician claiming that let the summer come and we will be conquering the COVID virus in the summer season. Now this is ridiculous. This is totally unscientific, and we do not have any proof of any climatic or temperature influence on the dynamics and natural history of the coronavirus. Positive contribution of inanimate objects, I have already told you, the door handle, the table, whatever inanimate object surrounds an infected individual. Always you should consider that any kind of inanimate object, including the floor of the room where the infected individual is staying, is contaminated with the coronavirus, and therefore be careful not to get yourself contaminated. Incubation period, that means after infection, the period taken for a person to manifest the disease ranges from 3 days to 14 days, or sometime it may be more, and as high as up to 35 to 40 days. Now the disease is classified into 4 categories. One is the asymptomatic carrier stage, or the persons who get the infection, who has the virus in his body but do not manifest at all. And these are the individuals who are playing the most dangerous, most important role in the transmission of the virus unknowingly to anyone, everyone. The other 3 stages are mild, moderate, and severe. Here is a graphical representation of the stages, as you can see here. The exactly the same way as I showed you a graphical representation of dengue disease dynamics. Here also, as you can see here, there are 3 stages. The first stage, which is almost asymptomatic or pre-symptomatic, it ranges from 1 to 2 days after exposure to a person, infected person. Here it is, and during which time the person may not have any symptom at all, or a very, very mild and ignorable symptom like little bit of malaise like this. within 2 to 3 days after the infection a person contracts, he moves on to the second stage, where the virus is multiplying at the upper respiratory tract or upper airways, including nose, mouth, and throat. As long as the virus is restricted within the anatomical boundary of this part surrounding the mouth cavity and the nose, he is in the stage 2. Now, and the later part of the stage 2, that starts somewhere between 4 to 5 days after the infection, after the first stage, and 5 to 10 days is the period when the person still remains at the middle, I mean, in terms of the severity, at the middle part of the severity range. That means acutely ill mild cases or moderate cases. Now, after 9 to 10 days, he moves on to the third stage, which is the most dangerous stage. That is the severe and complicated stage, when the virus and where the virus go down from the nose and mouth cavity through the bronchus or the windpipe into the lung tissue, and gradually it infects the entire lung, and it makes the lung from an airy structure to a solid structure, where the person is unable to breathe air in, and so his blood remains a kind of a blood where oxygen availability is very poor and very low. That is a condition which is known as a hypoxia. Now, at that stage, as you can see here there is, like the dengue virus, there are 3 colored lines here. This represents the amount of viruses and presence of viruses in the tissue, isolable viruses. As you can see here, this is the line which belongs to the mild cases. This is the line which belongs to the moderate cases. To get rid of the virus or the person to become free of the virus, it takes a little bit longer time than the milder cases. But in case of the third stage or severe cases, the virus line, it continues. That means as long as the viruses would be there, the patient would be manifesting in a severe way, and finally the viruses are there till the patient dies. So these are the virological presentation. Now, this graph, I'll come back to this graph once more to show you how the planning is being done, how we are approaching, how unscientifically we are approaching with the, I just give you a hints of that there was a news in the TV, and we know that the police force has been asked to go to the high-rise complexes and to preach for the pulse oximeter, and ask every household member to purchase a pulse oximeter so that they can identify the disease when to be hospitalized. Now the question is, the use of pulse oximeter actually comes at this stage, but a disease control program must consider to hit the disease at this stage. That means the initial stage. That shows how irrationally, how unscientifically we are approaching to control this disease by promoting, by advocating in favor of pulse oximeters use. We are ignoring the earlier 2 stages, and we are allowing the virus to stay in the community, and we are allowing the virus to play its own role for its migration from stage 1 to stage 2 and stage 3. And that is perhaps one of the reasons why we are getting short of hospital beds at this time, because all the persons are getting complicated because they are not addressed at the initial stage, where they don't need at all any kind of hospitalization. They can be treated at home. And instead, what we are doing, we are leaving these persons undiagnosed in the community to transmit, not only to transmit the virus to others, but also to complicate, but also to translate themselves from stage 1 to stage 2 and finally to stage 3. And that might be one of the reasons why West Bengal is seeing so much death for the COVID-19, and perhaps There have been issues, there have been discussion regarding the very high death rate in our country from, as far as West Bengal is concerned. Now, these are again the three stages I showed you. This is a slide to show you how the disease migrates. If it is not treated at that stage, it is automatically bound to migrate into the second stage and finally to the third stage. Now, symptom-wise, they get sometimes confused with many other diseases, and as a matter of fact, you people need not bother about these symptoms. I will rather preach for a kind of a approach or a syndromic approach for the common man. Any person suffering from fever right at this moment in the year, in the season, you should consider that the person might be suffering from any one of these diseases, because there is so much of overlapping as far as symptoms is concerned. You should consider a person with fever to be suffering from any one of these diseases, including COVID-19. Now, there is a lot of discussion about comorbidities. As we have seen, any person having comorbidities or previously having diabetes mellitus and blah blah blah, these are the diseases which makes the situation much worse, and they puts the person under severe risk of fatal outcome from COVID-19. There is another factor which is the age. 60 and above is the age group which is highly under high risk group and highly vulnerable to serious complications. Now, our concern about this virus is that this is a new virus. We know very little about this virus. The high speed of the spread of the virus, which is responsible for the pandemic. Majorities, however, this is a good news, that majorities are mild, but severe in the aged person and in persons with comorbidities. But in one hand, while we say that the majority are mild, and that is a good news, but that is a bad news too, because look, people get complacent. Okay, this is a disease where majority people they can get rid of the disease after some time without doing anything. But if they remain undiagnosed, if they remain unisolated, then these are the individuals, these are the mild to moderate degree of cases are responsible for transmission of the virus in the community. And that is the reason why we are now having community transmission so much, with so much of speed. And I believe that in the coming months, coming days, we are going to see more and more rise in the number of cases. As far as immune response is concerned, there are two types of immunity: innate immunity and adaptive or acquired immunity. Innate immunity is the immunity with which you are born, that cannot be modified. That is a natural kind of immunity that starts from a physical barrier over the skin, in the mucous membrane, in the form of mucus in the saliva, and some secretion like sweat and sebaceous glands secretion in the form of mechanical barrier and chemical barrier, to different specified cells like natural killer cells, which can fight at the initial part of the virus to restrict itself within the part of the nose, mouth, and the pharynx. And if the innate immunity is very strong in those individuals, and mind you, we cannot quantify, we cannot specify, we cannot identify an individual who is having the right type of innate immunity, which can restrict the viral growth within the limit of our face, within the limit of our upper respiratory tract. So this is completely a guesswork, or it's a kind of an observation. Once he is cured, you can see that his innate immunity was very strong, which cannot be modified by any kind of immunity, so-called immunity boosting agent. There is nothing, there cannot be anything which can boost up your innate immunity. This is totally wrong. Now, the adaptive or acquired immunity, yes, it can be modified either through suffering from the same disease or by vaccination. acquired immunity plays the very vital role in deciding how the patient is going to manifest, how the patient is going to behave after he suffers from the disease, and whether the patient is going to be contained by the immune response as far as viral load is concerned, or the virus conquers over, the takes upper hand over the host immunity. Now, these are the things. I'll skip some of these slides. There is no need of this. I mean, just typing all these in details. Okay, this is a schematic representation of the entire natural history or life cycle of the virus in a human host, how it enters through either through contamination of this stool from the children, through mother's hand, or through coughing and sneezing. The virus enters the respiratory tract, it infects the lung, and this is a picture to how the alveolus, or the farthest point in the respiratory tract down below in the lung, how it gets affected. Now this is in the right hand side. As you can see here, this is a picture of entry of this virus into the epithelial cell and emergence of the virus. Now this is a bigger, I mean, magnified picture of individual alveolus, just to give you an idea. I'm sure that you would be wondering, why the patient die of COVID-19? Why the lung is involved so much? Why doctor cannot save a patient after the lung get infected or involved? And these are the reason. This is the reason. You see what happens. As you can see here, this flask-shaped structure is the swollen or ballooned alveolus. An alveolus is the air sac which is present inside the lung, which holds the air and is surrounded by a membrane here, and below the membrane the blood capillary flows, through which the blood flows, which includes RBCs also, and these RBCs brings carbon dioxide from other parts of the body and enters the lung to get saturated with oxygen. It releases the carbon dioxide into the alveolus, and it receives the oxygen from the alveolar air into the RBC. So the blood which is coming to the alveolus is, I mean, unsaturated blood, I mean, with carbon dioxide. They are carrying the carbon dioxide, and the blood which is emerging out of the lung, it is now purified and saturated with oxygen. Now the question is, in case of COVID-19, what happens? A kind of a secretion, a kind of a membrane which is formed, which is gelatinous in nature, which is sticky in nature, and that creates a wall between the air and the blood vessel. And so at this stage, when the alveolus get involved, there is accumulation not only of this fluid or hyaline membrane, but also there is accumulation of inflammatory cells. And at this stage, these are the inflammatory cells which produce biochemical protein substances which are known as cytokines. And these cytokines are very vital in triggering series of interlinked biological processes, which is known as cytokine storm, which produces series and multiple type of cytokines, or like kind of a, as you know, people know what is hormone. So this is kind of a biochemical product which is secreted by the cells. Individual cytokines, they have their own individual function. Some cytokine is responsible for creating fever. Some kind of cytokine is responsible for inviting different cells into that particular location. Some cytokines are responsible to make the blood vessel more dilated, more enlarged. Some cytokines are responsible to create a kind of a situation where there is accumulation of fluid, and blah, blah, blah. So through this production of cytokines, which is dependent on the multiplication of the cell, which again is triggered through the immune response, where the body is fighting against the virus, but in turn they produce so much of, so hyperstimulated, they get so hyperstimulated that the stimulation remains unchecked, uncontrolled, and there is production of a huge amount of cells and the cytokines. These make the alveolus totally airless, and moreover, there is a barrier is created between the air space and the blood vessel, so that the person, he do not get the required amount of oxygen from the lung, so he suffers from hypoxic state. And once the person remains hypoxic state, the every organ, right from the brain to kidney to lung to liver, everywhere there is low oxygen level, and the person dies of hypoxia and malfunctioning of different organs, which is known as multi-organ failure. Now, so therefore, to prevent such kind of alveolus to develop, we must address each and every patient at this initial stage. That means the state or the authority, the administration will have to develop that amount of both quantitative and qualitatively, that kind of a diagnostic setup where we can identify each and every infected individual at this stage, so that they can be easily treated, they can be isolated to prevent the transmission of the virus to others. Now, diagnosis, with a few things, as you know, the COVID-19 is being diagnosed by different ways, but right now we are having the RT-PCR as one of the method, which is done from the nasal and pharyngeal swab taken, and that secretion is supposed to contain the viral particles, and that is identified through the process of polymerase chain reaction, what is known as PCR, and RT means real-time PCR. So other diagnostic tools include antibody-based diagnostic tool and antigen-based diagnostic tool. They are also very helpful. Particularly the antigen-based diagnostic tool can be of very great help, particularly to pick up the infected individual, to identify the infected individual at the very early stage of the disease. Now, therefore, these are the three diagnostic tools: a molecular diagnosis through PCR, and then detection of viral antigen. The first and the second one detects the presence of the presence of the virus, while the third one, detection of antibody, can say not only the presence of the virus, but maybe it says the presence of the antibodies. That means it can indicate who are the person who got the infection in the past also. Now, the treatment options, there are, that's one thing I tell you as far as treatment is concerned. So far, till today, we do not have a very well organized specific treatment protocol for treatment of COVID-19, and we do not have a specific antiviral drug. But we are using as an experiment, therefore, ICMR has given the status to these three drugs as an investigational treatment or investigational antiviral drugs. That means these are all experimental. It is not assured, because these are the drugs like remdesivir, lopinavir, and ritonavir combination, and favipiravir. These are the drugs. They are meant for other viruses, and we, under a frantic situation where we are frantically trying to save the patient, we are using any one of these drugs, or maybe more than one of these drugs, to try to attempt to see whether these drugs, at least some part of the drug, can affect the virus, so that at least we can have some effect on the viral multiplication and viral load. But unfortunately, we do not have so far very well organized, double-blind, randomized clinical trial to show 100% efficacy of these drugs. and therefore these are optional drugs. These can be used. Of course, we are using these drugs. Other drugs are targeted against the, as I told you, that hyper stimulation of the immune system leading to hyperinflammatory state. These are the drugs which are targeted towards the diminution of the inflammatory status of the patient, like hydroxychloroquine, tocilizumab, and convalescent plasma from the cured patient. As far as convalescent plasma is concerned, we are yet to establish any definite role. We are not sure whether it acts or not. But hydroxychloroquine and tocilizumab, they are very known anti-inflammatory agents. They are very known anti-inflammatory drugs. One thing I must make a caution, that hydroxychloroquine is not a drug which is going to prevent the infection by COVID-19. That means, contrary to the practice which is going around, even through the government machinery, distribution of hydroxychloroquine has been underway to various parts of our community with the rider that this is a drug which prevents the infection, which is totally wrong. Hydroxychloroquine is an anti-inflammatory drug. It has no antiviral role to play. Therefore, you should never take hydroxychloroquine before suffering from COVID-19 with the idea that you might be protecting yourself from the infection. This is totally wrong. We have ample of evidences and examples to show you. People who are already taking hydroxychloroquine have died due to COVID-19 after getting the infection, which was totally failure. So it is never a drug to be used as a chemoprophylactic agent. Of course, it has some role. Once a patient suffers from the disease, and which the patient, once it enters the moderate degree or the second stage or third stage, there we are using hydroxychloroquine to minimize the inflammatory response by the host. Now, with all these, now let us come to the concluding part of my presentation. Knowing all these things about the severity and the very dangerous part, very dreaded part of these two diseases, along with many other similar diseases, how are you going to control the disease? What should be our approach? And what we have so far done in containing this disease? Let me tell you, this is not a job to be done by government alone, neither a job of a medical practitioner, nor a job of an individual person. It has to be done through a participatory mechanism along with the community, be it the government, be it the medical fraternity. It has to be done through a participatory mechanism, taking into confidence the entire community. And of course, there has to be a very strong and decisive participation of scientists, individually or collectively, whatever it is. But scientists and regular scientific input of information is a guiding force towards development of right type of control strategies, and whenever needed, it gives a flexibility. Whenever needed, we can change our course depending upon our achievements and target. Observations made so far in regard to the control of COVID-19 and dengue by the government and the society, I had tried to put it in this way, that there is definite lack of planned and scientifically rational control strategies. There has been no sign to show that the last 7 months we have ever seen anything which is actually planned scientifically. Lockdown definitely is a phase where actually it is meant to buy some time to prepare ourselves with aims and objectives and set the goals towards control of the disease and to prepare a kind of a blueprint for a control program, area wise or nation wise. But unfortunately, we did not prepare ourselves during the lockdown period. And again, we are talking about lockdowns and lockdowns. It's of no use. I believe that all of you should appreciate this, and you definitely agree with me that we have seen a lot of lockdown, but lockdown means putting a person inside the house. How does it matter? Without anything, okay, you can put a person inside a house, you can arrest a family inside a house, but you must give support to identify a diseased person, identify the infection, track the infection, trace the person from where he got the infection, and do accordingly. We have not done anything. And gradually we are seeing the outcome of such kind of a lockdown, which is totally unplanned, totally unprepared, and by that which time we did not prepare ourselves to face the next challenge. We did not create the hospital beds correctly, and we are facing, as I already told you, we are targeting, the government is targeting the stage 3, while the government should have targeted the stage 1. Instead of asking the patient to buy pulse oximeter, the government should have set up multiple and number of laboratories to cater to the need of the community at the community level, so that very close to your house, you can go walk down to a laboratory where you can be tested. You have to know whether you are infected or not and do accordingly. Instead of doing that, we are allowing the person to stay and migrate from one stage to the other. And then we are now facing the shortage and the crisis as far as the hospital bed is concerned, which was ought to happen. Diagnostic facility, as I already told you, that we have not yet developed an adequate and appropriate diagnostic facility. We are somehow, and I don't know for what reason, we are bypassing, we are avoiding to create diagnostic facilities. I do not know, but maybe with the fear that the number of infected individual in record will go up, and that is a black spot in the credibility of the government. Perhaps this is a wrong impression. The disease is not a creation of any government, any person. This has come from the nature. This has spread because of its character. We must consider, we must confess, we must accept things at its face value, and then we must disclose everything to the community and put the community under surveillance and monitoring, which we did not do. Even after 7 months, we did not develop any kind of surveillance mechanism. We did not develop any kind of monitoring system to monitor the individual community, individual households. Nothing has been done. Separation of two facts and figures, we are all aware about this fact. Keeping the community at dark. There are very sad stories, keeping a community at dark. We have seen various stories. People are dying. People are committing suicide. People are dying after moving from one hospital to other. We have been telling that apart from COVID, there are other diseases in the community. We are facing dengue, we are facing malaria, we are facing renal complications, we are facing diabetes, we are having heart diseases, various diseases. Where is the place? How do the patient go to the hospital to get the right type of treatment for diseases other than COVID? As if the entire country has got only COVID as one single disease and we do not have other diseases. And people are dying because of this situation of giving more emphasis on the COVID and neglecting the non-COVID diseases. Community transmission. There was a, excuse me, just a minute. there was a ceremonial announcement of community transmission. Here I should give some example from which you can understand. Community transmission has been a very widely discussed issue, not only in the media, but also in the community and even inside the professionals community. Transmission means a kind of a transmission situation where a person who gets the infection, whose source of infection cannot be identified. And that is the right type of definition, which has happened way back in the month of March or April in Calcutta city itself. And today, maybe about 4 or 5 days back, the administration officially announced that we are having community transmission in some places. It is ridiculous. We are already going through a very, very high degree of community transmission. It has taken place at least 6 months back, and we are avoiding. What for? Why? There lies a big question. Then the question comes: active case detection and passive case detection. Any kind of say control measure has got different steps. I'll show you later on. Now, active versus passive case detection means active case detection is a type of detection of individuals with the infection where the institution comes down to the community and moves from one house to the other to search who are the symptomatic individual, and blindly sometimes takes a sample from healthy normal individual to see how many persons are asymptomatic carriers and how many persons are suffering from the symptom. Instead of waiting at the laboratory when a patient reaches from stage 1, stage 2 and stage 3, that at stage 3 he is brought to the hospital for treatment. That is the situation which we are facing in our community now. And I would very strongly preach in favor of the diagnostic facilities to come down to the community and actively search who are the persons they are infected. And that should be a kind of a challenge, and that is a kind of a challenge by the virus, which is being given by the virus about its dynamic spread and existence. And we must fight it out, and we must kind of map it out. Where is the virus? Where is the source? And unless we identify the source, unless we map it out, we cannot take necessary measures to contain the disease. A few words about home isolation. Now we are observing a very peculiar kind of advice from the government sector and from the society also. This is most unfortunate. Why the society would be behaving towards to the patient of COVID-19 in such a way where an infected individual is being asked to keep himself locked in his own house, not to come out of the house, even if he is suffering, even if he is having some symptom, even if in a stage where he needs doctor's examination and medical help. You know, we are observing a patient who is being diagnosed now and not that sick to be hospitalized. Then, yes, even in second stage, the patients are advised by the government sector or the corporation and the government, okay, you go to house isolation. You don't need hospitalization, go to house isolation. And that's the end of the story. He gets completely locked down in his own room, and the enormous amount of suffering through which the person is going through, we are observing it daily. My request to the community would be, please don't act in that way to isolate the individual and stigmatize the individual so that his suffering remains unknown to the doctors unknown to the health professionals, and he dies a silent, locked death inside his own room. Ideally, home isolation should allow a doctor to visit his house or a laboratory person to visit his house to take regular interval blood samples and other samples for clinical evaluation, and a doctor must be allowed by the community to visit his house to clinically check the patient, to assess what is the situation and have a right type of assessment at what level he may need a kind of hospitalization. Unless we do that, many people are going to die, and that is what exactly happening. It is unfortunate that even the medical need of suffering individuals are being ignored by the housing complexes and the community at large. This is totally wrong. We must help the patient. By helping, we are not going to suffer. Even in spite of putting the person locked under his room, my question is, are you safe? Has anyone stopped the transmission of the virus in that locality? Is he being able to stop the viral spread? No. Even after detection of one case, there will be a series of cases appearing in that locality. Where from it comes? That is the community transmission. And at this stage, we need to help the infected individual, suffering individual, so that he gets the right type of the treatment. It is his constitutional right. It is the human right which deserves the right type of attention from the community as well as from the government. Both of them, both the community as well as the government would be held responsible, at least to me, would be held responsible if a person dies inside a house, locked and without any attention. Now, participation, the politicians, why they do, sometimes they come out with their study reports. One such study reports, it is being said that the slum area is not the area where COVID is present. They suffer much lesser, and it is the high-rise and housing complexes who is responsible for transmission of the disease, transmission of the virus. Unfortunately, they are not scientists, they are not epidemiologists. This is a very wrong thing. This makes the community totally confused. And this is not the time of spreading such kind of, making such kind of comments out of nothing. Can't you imagine? A slum dweller doesn't have that amount of fund, that amount of financially is not that sound to go for a kind of a test which involves a cost of around 3,000 to 4,000 rupees. And there he remains, he keeps himself in the slum area, in those areas, in his house, or with the idea that, okay, I have a little bit of cough and cold. Maybe that I was exposed to cold. Maybe that I took some cold water. I got exposed to the cold water, and then I got something like that. And fortunately, majority of such individuals get cured in the form of subclinical, or the spontaneous cure. As I told you, majority, around 80% of the individuals, they cure themselves without moving from stage 1 to stage 2. And that is the benefit of the disease. But that is again a kind of a situation which puts us in a very complicated situation by not addressing these areas. While the person who had the fund, financially sound, the entire family can go for investigation, and that increases the number of positive reports from the affordable persons and not from the slum area. They didn't see this kind of a difference. Instead, they are making such kind of a statement which makes the slum dwellers more complacent as far as their day-to-day life, their lifestyle, their movement, wearing a mask, moving here and there is concerned. They are moving freely. Oh, नेताजी बोल दिया है, ये हमारा हमसे कुछ नहीं होता है, चलो. So this is the thing which is going on. This one must consider and one must protest that this is not the thing. Unless we go for testing in those areas in the community, we won't be able to do justice to the scientific evaluation and interpretation of observation. As far as the society is concerned, therefore, society, the COVID-19 has brought a very ugly and nasty face of our society. I know a father died because of the negligence of the son. I know a very pathetic story. A person having 3 sons for whom he borrowed money in their childhood days to get the treatment for dengue from my clinic. The same person died without the help from the son. The son abandoned this father to die alone in the hospital unpaid. This is one story how the son is, because of this kind of a I think taboos and stigmatization and wrong belief that going very close to the COVID patient will harm the individual. And these are the areas. On the other day, a child was brought to me around 21 years of age. The father brought the child to me. The child went to shock. He collapsed. Myself and my assistant, we went to the child without any protection because that was a sudden development. Without any protection, we got ourselves exposed to the child to save the life of the child. But unfortunately, very, very sorry to say, we have seen the father dying standing at a distance and observing and doing nothing. And this is the society. Can you imagine this kind of a relationship? What kind of society we are living in? And this is why we need a social development. Maybe COVID has shown us the weaknesses, the defects in our society. And this is the area where all of us, we must try to develop our society so that a kind of a feeling, a personal feeling, a kind of a human feeling develops in our society. In one media, Bengali news channel, there was a very unscientific promotion regarding the role of refrigerator as a super spreader of COVID. I believe many of you have gone through that show, and also as a follow-up action, yesterday I went for another show in another channel just to say refrigerator has got nothing to do with the spread of the COVID viruses. Like this, there are different kinds of myths, and I do not know why these are being spreading through various kind of social media, and including the digital media and the audio visual media, even in the TV, that these kind of very wrong things are getting spread by these media. Why, I do not know, but all of us, we must take everything with scientific flavor. Please try to generate a kind of a rational thinking, a logical thinking before accepting anything which comes into the media, whether it is from government or whether it is from the social media or TV media or whatever it is. Please make yourself highly rational and justified. Think logically, think rationally. The ideal control, at last, what I told you, that it should be a kind of a partnership program between government, scientists, and the community as a whole. The entire control program can be spread, can be divided into 4 phases. Number 1 is a preparatory phase where we try to generate information. We generate a kind of a database on the basis of which we plan a program and then attack. And once we attack the disease, we achieve something after setting the goals. And then once we achieve that goal, we consolidate ourselves to areas where that need more and more emphasis. And finally, once we are able to contain the infection rate contain the disease at a very lower level, we must maintain that level through a maintenance program. This is how one should initiate a kind of a program. And as far as government is concerned, there should not be any hiding to whatever extent it may be, taking into confidence the community, and every type of community has to be taken into confidence. The government must show the community that there is nothing to be panicked. It should not stay as a mere statement. You should not panic. You should be careful. Instead, you should show the people that why they should not go for a panic reaction. That means this brings to the point that the government must create a kind of a facility where the community must feel confident that yes, we have a place, we have facility, we have a system. Whenever we suffer from this disease, we can have the assistance by the government so that we do not have any problem. We can freely address all these issues. And because of these reasons, perhaps because of these reasons, from the community's part, the things like concealing the facts, hiding themselves, it comes from this kind of ill-organized control programs. And subsequently, there has to be review of everything, that how far we have gone. And of course, if needed, the course can be changed, and therefore it has to be a flexible, totally flexible program, and with always a kind of a scientific information putting into the program. Lastly, from the government part, the community must be put under IEC program, that is information, education and communication. Information means the government is to inform the community everything about the diseases, everything about what measures have been taken so far and what kind of facilities, every details about the disease and its control, and the participation, kind of participation which the government is expecting from the community. This is a kind of a bilateral exchange of ideas and confidence. Thereby, you educate the people. E stands for education. So information, then education. Once you are certain that the community has got the right type of education about the disease, you try to assess that education through KAP. And communication, C stands for communication. Once the community is known to have developed a kind of right type of KAP, that stands for knowledge, attitude and practice. That means through the education, the kind of knowledge the community acquired, that has to be translated into a kind of an attitude to follow that, to implement that knowledge in practice. So KAP is a kind of a assessment mechanism for the success of IEC. And finally, a kind of a continued communication. There should not be any break in the communication chain between these three partners: government, scientists, and the community. And then only we can address this kind of pandemic and epidemics rightly. And therefore, the community should be confident about the state's support, unbiased support, remove all taboos and stigma, and be humane. Like, this is a picture, let me tell you, all the Bengal people, they are quite familiar with this picture. Dhakis, they have three components: one big dhak and one kurkuri, like the middle child, and the other is the ghanta. You know, in my younger days, I was very famous for Dhrunochi Nach, and I could not, at that time, even today, I cannot withhold my legs from beating whenever I listen and see these three persons beating the drum and the ghanta. The rhythm is so nice that you automatically you feel to be a part of that kind of event. And this represents a community participation between three partners to conquer the disease like COVID: a drum beater, a kurkuri beater, and a ghanta beater, representing the government, the scientists, and the community. The three partners beating together makes everyone very joyous and participatory to participate to take up the event of conquering the disease like COVID. And lastly, this is a picture to show you that the two pillars for a nation. As you can see here, a blind man walking with the support of a normal policeman who is healthy. And this blind man, without the help of the policeman, cannot stand, cannot walk. And similarly, without the support of education and health represented by the policeman, a country is like a blind man who cannot walk in a right direction. With this elaborate, I thank you all for patient hearing, and I hope that whatever my expectation goes from the community, from the government, or all of the participants, you will be fulfilling my expectations. Thank you very much.
Thank you, sir. This is absolutely an amazing and effective presentation which reflects the transparent image of different corners in the current scenario where we all live with the risk of being infected either by COVID-19 or dengue virus. And thank you, sir, once again for being with us and sharing this valuable point so elaborately indeed with us. Thank you. So now this is the time for the question answer session. Lots of questions are there, but sorry to say that due to time constraint, we'll take limited number of questions and one question for one participant. So first one question, sir, from Anisha Kaur. I have thyroid dysfunction, depression, PCOS, and endometriosis. How susceptible I am to COVID-19?
You see, thyroid function. Many of the things are not known about the COVID virus so far, and as far as thyroid function is concerned, we do not have any idea. But this is, you can believe at least that thyroid being a very vital organ and plays a very vital role in the immune response and immunity, and the interaction between the microorganism, it plays a very vital role. So definitely hypothyroid individuals, it is yet to be proved, might be having some kind of a risk factor as after acquiring the COVID infection. Any more question?
Another question is how long coronavirus can be alive in a dead body after death of a COVID patient?
The coronavirus, like many other viruses, they are all intracellular organisms. They cannot survive outside the cell. Or whenever the cell dies, it cannot survive. That means after the death of a COVID infected person, the virus cannot survive for much longer time. Exact time frame, how long it can survive, we have no idea about that. We have no definite answer to that. And we also do not have any idea about the virus's capacity to multiply or to, generate and infect. That means the infectivity of the virus. As I told you while I was telling you about the RT-PCR, that picks up the part of the genome, that identifies the part of the genome without saying whether that genome is capable of multiplying or not. we do not have any idea. But to be on safe side, it is several hours. It's roughly all throughout. People are considering several hours, maybe 5, 6 hours, that a dead body can be kept before disposal or before declaring that it is safe to be handled. But again, I should say that if someone wants to dispose the body after death, just normal physiological declaration of death, it takes around 3 hours. So after declaration of the confirmation of the death, the body can be immediately taken for disposal, taking appropriate antiviral or protective measures.
Okay, sir. Thank you. And another common question from three participants, Meenakshi Haldar, Nurbanu Sattar, Amit Datta, that is, as per government suggested, N95 mask cannot protect from virus. Then what kind of mask should we use? Which type is the best type mask to be used?
No, I think they have misunderstood the government advice. The ICMR say, even WHO say that in N95 mask, there are masks with respirator. You might have noticed that outside the mask, something is a kind of a spherical window would be coming out bulging, and there is a valve. It is a question of the N95 mask with the respirator, which is not allowed, particularly at the community level. And within the category of respirator mask, there are two types of respirator having two types of valves. One valve is one direction, and the another type of respirator which has both the direction of the movement of air. In this case of unidirectional respirator mask, what happens? The air enters the mask or the user after filtration, but when the question comes of breathing out, that breathed out air goes unfiltered to the environment. That type of mask is not allowed to be used by community people. It's not N95 masks in general. N95 masks are to be used only by the health professionals, right from the doctors to health workers. Common man may not use N95 mask because it is not needed for them. A 3-layer or 6-layer, even cotton mask is good enough to protect himself from the droplet infection.
Okay, sir. Thank you. And another last question is from Rachana Pramanik. Sir, how does the conformational change of the hidden RBD of S protein help in viral attachment and immune cell evasion?
Could you repeat that question, please?
Yes, sir. Sir, how does the conformational change of the hidden RBD of S protein help in viral attachment and immune cell evasion?
Oh, that is through a kind of a protein. So firstly, when there is attachment of the spike protein to the ACE receptor, as I showed you that there is through another enzymatic process, there is a cleavage, and the virus enters the host cell through endocytosis, and there through another proteolytic enzyme, there a vent is formed in the envelope of the virus, through which the genome is injected into the cytoplasm of the host cell, and at that point the virus starts producing a kind of a protein which, when comes out, it prevents the host immune response to kill the virus through different kind of enzymatic process. That has been, at least one such viral protein has been identified by which the virus evades the innate immune response, killing the virus. And that is generated in the same cell epithelial cell.
Okay, sir. Thank you so much. We can't allow any question further. So, thank you all the participants for your live participation. And we have reached almost at the end of the session as well as of our webinar series. And there is announcement for our registered participants. So, feedback form will be sent to you via email shortly. And fill it up and submit the form as early as possible so that we may process the issuing of the e-certificate. So now I'd like to request Dr. Nivedita Bain, joint convener of this webinar series and faculty of the Department of Sociology, P.R. Thapar Government College, to propose a vote of thanks and conclude this web series. Thank you. Nivedita, please.
Yeah, thank you very much, Lily. And as we have reached the end of the session, so I would like to I would like to express my gratitude to Dr. Amitabh Mundi, who wasn't ill, who was ill the first day when we decided to conduct the end of the webinar series. So today we are really glad to have him amid us. And at the end, I would like to express two or three of my opinions before I give my final vote of thanks to the team who worked relentlessly to make it a grand success. The thing is that in 1997, in 1977, Michel Foucault, who wrote a book, The Birth of Discipline. Here, in that book, he mentioned two or three things. The first thing he mentioned that the great break in the history of Western medicine did precisely from the moment clinical experience became the anatomo-clinical gaze. He focused mostly on the gaze. That gaze is like how we are looking at the people, disease, and how we are protecting ourselves, or how the government is actually coming into this scenario, and how the role government, or he used the word governmentality, is working or designing the conduct of conduct. And Dr. Nondi also focused on or tried to bring our attention to this particular point, that we need to very much careful about our conduct, and how we would conduct in such situation while living night is dissipated in the brightness of death. That is very important for us, that we should very careful in deciding our conduct. And the conduct, the instructions of the conduct is coming to us, and we need to use our uh, in wholehearted uh, wish, and that sense logic to decide and to react to those conducts that are given to us. And that by telling these things and expressing my views, I would like to uh, thank to my team who worked relentlessly from the 1st of July to this 25th of July to make it a success. And they worked. I just can't say you that we are separated, we are isolated. So being isolated, we're still working, and we are feeling that uh, this is a social distance might be there, but still we are feeling that we are very much connected, and that team are very much connected with each other, and that connectedness and that feeling for each other and love for each other, that is the most important thing at this moment we need. That is again reflected in Dr. Nundi's speech, that we are not feeling for our fellow human being. We are reacting in a very different manner, that need to be corrected. So I can say that our team is showing that we are support each other, and we are working, and we work together as a just a beginning, not the end or not the final things. I think this is the strategy that we can offer from us as citizens of this country, that we can we should be must be patient, and that will actually lead us, or that will to survive. Thank you very much for your kind patience, and we will share the feedback form at the end of this session, and that is very much required for us, and that will our code of conduct for our future endeavor. Thank you very much, everyone, and of course, Dr. Nomdi, for your kind support. Thank you very much.